Nowadays, we are seeing a lot of endometriosis cases. So, what is endometriosis? Basically, the inner lining of the uterus, it grows outside the uterus, mostly on the outer surface of the uterus or in other pelvic structures. So, like in the fallopian tubes, ovaries, or other pelvic organs like urinary bladder. What happens during each menstrual cycle when patients have bleeding, there is some amount of bleeding and inflammation. So, that causes severe pain and heavy bleeding during the time of periods. This is the reason why patients with endometriosis have severe menstrual cramps.
How do we know that we are having endometriosis?
Patients with endometriosis can have heavy menstrual cramps, severe menstrual cramps, heavy bleeding during their periods, painful intercourse or painful sex, pain during passing stools, pain while passing urine. Sometimes patients can have infertility later on in their life.
So, doctor, what is the treatment for endometriosis and how can we prevent endometriosis?
Prevention is slightly difficult because most of the time patients have some genetic factors. Sometimes early pregnancy and breastfeeding helps in these patients. Treatment is certainly, there is a lot of role of medicines if we have been diagnosed it early. There are various surgical options, like with laparoscopic surgeries, we remove the various chocolate cysts which are there inside and we remove all the adhesions which are there within it. So most of the time it is diagnosed or as an incidental finding on ultrasound. They come with a chocolate cyst or some ovarian cyst or some other mass basically inside. So if it is there, they should take the treatment even if they are not having any symptoms, because later on in their life it can cause fibrosis and adhesions if it is long standing, and that can cause severe chronic pain, severe backache, and later on infertility also. So it is very important to treat the endometriosis at an early age.